Hi, this is Greg Johnson with resourcesforlife.com, and this video is about the healthcare crisis. We've been reading a lot in the news and viewing a lot on the web about the topic. And I had an anecdote I thought some people might find interesting relating to this topic of healthcare. I was working in a doctor's office doing some computer work, and the doctor, as a patient was getting ready to leave, said, hey, I'd like to send you home with some samples of presumably what normally would be drugs in most doctors' offices. And I've seen this scenario before. I've worked in offices where I'll be working on a computer and a pharmaceutical company representative will come and entice the doctor to take some free samples to give out to patients, promote these drugs, and maybe give them some pens and calendars and that type of thing. So, and then, of course, the doctor then passes these things on to patients to get them to start using these drugs. And I don't know if there's any kickback or benefit to the doctor. Sometimes there is. So anyway, this doctor's office that I was in, though, was different in that when the doctor offered to give the patient some samples, what the doctor was referring to was vitamins, minerals, homeopathic, herbal kinds of products. The person wasn't sick. These were nutritional supplements to help maintain wellness, prevent sickness, improve health. The entire doctor's office where I was at is actually designed not to wait until somebody's so sick that they need, to go to the emergency room or need severe pharmaceutical drugs to respond to some health problem. No, instead, this doctor's office focuses on keeping people well. In other countries, doctors benefit financially from, getting people well and keeping them well. But here in the U.S., the financial rewards come only when people get really sick and then have to go to the hospital. So anyway, I guess in light of the healthcare crisis, I do think people need, access to healthcare, but I also think we need a totally different system than the one we have right now. I think it would be much better to have a system that focuses on wellness and on, health promotion rather than a system that reacts to sickness. And I know that some people out there might say, well, that's unfair, that the healthcare industry does have, an awareness about preventative health, preventative medicine, actually. Well, there's another anecdote, which I think is not just a unique incident. There's a person that I was talking to the other day who has to pay for a supplement. It's a nutritional supplement that is clinically, medically proven to prevent a specific illness. And so she takes that. But she has to pay for that because her healthcare insurance provider, which is Wellmark of Iowa, they won't pay. They won't pay for this simple little inexpensive supplement that this person is taking. They will pay once she gets so sick she needs to be admitted to a hospital. Then they'll pay for that. But they won't pay for the prevention. So I think that anecdote, that story, is actually one that many people can relate to. I think it's something that's happening over and over and over again, is that, healthcare companies, healthcare insurance providers are essentially structured so that they are only going to be there if something severe happens, if somebody, gets sick, and then there's going to be care provided for them. And it's really difficult to get funding for preventative procedures, preventative practices, and anyway, so I guess that's it. That's just a few thoughts on healthcare and wellness, and I'm curious to know what other people's thoughts are, so if you want, go ahead and write or send a video back in response. Thanks.